Welcome back to the Better Health Now podcast. Excited to have Dr. Licata, a pediatrician, here at Coleman Regional on our summer safety series for children. Excited to talk about the topic of safe sleep for infants. To get us started, can I talk a little bit about maybe some of the numbers and kind of just as we kind of before we dive into kind of talking about the ABCs of safe sleep?
Yeah. So thanks again for having me on this podcast. I'm excited about talking about this topic. While, of course, it is important to discuss it over the summer, let me be clear that it is important all year round for safe sleep for infants. So, getting into some of the numbers, just to put sort of a summary on it, there are a couple thousand, about 3,400 sudden unexplained deaths of infants that we just don't have a great reason for. Most of the causes come down to a breathing issue or suffocation. And unfortunately, a lot of those happen while the child is sleeping.
Yeah. And so, kind of as that new parent is leaving the hospital, maybe their first time parent, it's a whirlwind of emotions and feelings, and just getting out of the confines of the hospital. It's
Yeah.
it's kind of you're on your own kind of thing.
Yep.
Um, getting take that moment they leave the ABCs of infant sleep is a very important thing to think about
Yeah.
and kind of to almost reiterate as they are kind of working through those first few days, first few months.
That's right.
Talk a little bit about the ABCs, kind of starting with A.
Okay. So we do hope that in the newborn nursery, the doctors there are sort of impressing this upon the parents. But I think it's one of the first decisions that we have to make. While it might not be the easiest for the newborn or the infant, it's probably best for them. So there are lots of things along the way that it would be easier, or the baby will do better with X, Y, or Z, but it's safer to do it this way. So the ABCs of safe sleep start with the child being alone. So a lot of that points to not sharing the bed with the child, not putting the newborn in the bed with you for the risk of rolling over on the child or having sheets or blankets or pillows cover the child. So the B is to place that child on their back. So they should be alone on their back, and then where they should be placed in a crib, hopefully on the firmest, most boring surface that you can think of. Not comfortable, not plush, not extra soft, but the safest for the baby. So this all started back in the 90s when we shifted from putting babies on their stomach, noticing that lots of babies unfortunately could die, that they should be placed on their back. And then we just added other features to that safe sleep environment to create the ABC mnemonic.
Yeah, and it's not necessarily we're not saying room share is a bad thing. We're
That's
saying
right.
bed share is a bad thing.
That's a good point.
And
So
and
thank you
so
for pointing
I
that
I
out.
think
Yeah,
that's you're wanting to keep your newborn close to you,
absolutely.
but not so close that they're in the same bed with you. And
Yep.
I think that's sort of the distinction because I think it's looking at some of the notes. The first 6 months, if possible, to decrease the risk of sleep-related death by up to 50%.
That's right.
And so it's a very not necessarily small thing you can do, but it's a very intentional thing you could do for
Yep.
the safe well-being of your newborn.
Yeah.
Kind of diving into kind of sort of the next sort of there's another sort of level outside of the ABCs, which is just sort of just risk reduction in general with newborns. Talk a little bit about kind of first maybe with pacifiers and kind of going into breastfeeding and some other things.
Yeah. So I think these are a couple of things that potentially we're already doing for the baby, but we've just learned through studies and research that actually the babies who did use a pacifier or the babies who were breastfeeding did actually have better outcomes when they slept. So while a parent would probably, and I myself am guilty of using a pacifier to quiet the baby down when they're crying, while they're sleeping, it can be helpful to allow them to breathe differently, more through their nose than their mouth. And yes, you think you're blocking that airway, but you're actually providing them a different way to breathe that keeps them safer while they're sleeping. When it comes to breastfeeding, we're not exactly sure why that is most effective. But part of it should be that proximity to the parent. You have to be close, right? In the same room, but not the same bed. But just another benefit of breast milk, as much as we can encourage a baby drinking breast milk, this is one other reason to do that. Some of the other things that can reduce the risk is this is really for breathing issues in general for newborns and infants, is trying to keep a smoke free environment at home. We were, of course, very excited when that happened in restaurants and airports and airplanes when you can't smoke anymore. But in the home, in the living room, in the kitchen, and also in the bedroom, that smoke exposure just causes enough irritation to the lungs that can lead to negative outcomes while a baby is sleeping. And finally, using tummy time while the baby is awake is one, a way to get the baby on their tummy where they are most comfortable, right? We just don't want to do it while they're sleeping. So it allows them to have less time than they normally would on their back. We reserve that just for sleeping and allow them to strengthen their muscles and their tone and their breathing while they're awake.
Yeah, and we mentioned at the beginning that this is a safety series, not necessarily strictly summer things,
Yep.
but a big thing to think about for newborns at any time of the year. Specifically in summer, it's definitely something to think about, as well as overheating, which we haven't really talked about. Talk a little bit about that and the importance of being aware of their newborns, uh, y- its temperature, and just
Yeah.
making sure that it's not getting overheated, and kind of ways in which not only in the summer to look at this, but also really anytime.
Yeah. Yeah, so this is a good point that parents really do come with questions. They are thinking very carefully about, how do I keep my baby comfortable? A lot of parents don't like when their baby sweats, and grandparents don't like when their hands and feet are cold, right? So it's on their mind, but just trying to give them practical steps for making sure that this is probably a safe, normal temperature environment for the baby. I like to describe the scenario of a baby wearing one more layer of clothing than you would. So typically, if you're comfortable in shorts and a t-shirt, the baby should have light but long pants, and then a t-shirt but a long sleeve t-shirt. And so that's one extra layer, a little bit more body coverage, because they just are so sensitive to changes or variations in temperature. So that's the first thing, making sure they have a little bit more clothing, even in the summer, than you do. But then keeping the temperature of the home at more of a normal level. And so somewhere between 68 and 72 degrees should be comfortable for the baby. And if the listeners' homes are anything like mine, our temperature on the thermometer might be 72, but it's always 3 degrees cooler in my son's room. And so you just have to consider that too. Perhaps having a monitor or a temperature probe in that room can help to make sure that that exact sleep environment is the safest it can be.
Yeah, and I mean, I think, we talk about we talked about it in other episodes you've been on as well, just that, the whirlwind that those new parents go through, leaving the hospital with a newborn, even if it is your first or if it's your third or whatever child it may be, remembering these sort of guidelines, remembering the safe sleep, remembering these sort of, it can get overwhelming, but I think coming into it with the ABCs,
Yep.
coming into it with just these 3 or 4 points that we've discussed is a great starting point. And I think having resources, like your pediatrician and like, medical providers, to answer questions that you maybe don't know the answer to, and you're not gonna know everything, but being willing to ask, and finding resources out there. So we'll be sure to have everything in the episode notes,
Awesome.
other resources for, people listening if they're wanting to find out more information, but I appreciate you being here today.
Yeah, thank you so much. And just one last thing. I know that we as pediatricians can often overwhelm parents. And so we do have to remember to keep it simple, give them easy things to think of, and just make sure that our babies are safe.
Awesome. Well, I appreciate it. Thank you.